Hi, I'm Jamie Trin. I'm Carmen Elliott Reed.
My name is Omalara Saka,
And my name is Jocelyn Muller.
and this is our stress management for healthcare workers presentation. According to Global Quantitative Nursing Research, a shocking 70% of healthcare workers experience high stress and burnout. Recent studies also report a significant percentage of healthcare workers facing symptoms of burnout and emotional fatigue. With that being said, it is important for healthcare professionals to explore effective strategies to cope with the demands of their roles while also maintaining their own mental and emotional well being. Our presentation will discuss the crucial topic of stress management and the effective strategies to maintain the overall well being of our healthcare professionals.
So, who are our healthcare workers? They are registered nurses, personal care aides, physicians, medical records specialists, just to name a few. According to the Bureau of Labor Statistics, healthcare employment accounts for 9.3% of the U.S. total employment. In 2022, there were 14.7 million people employed in healthcare occupations, with registered nurse top at 3.3 million. Furthermore, 8 out of 10 healthcare workers are women, with a reported average weekly hours of 38.6 hours, according to the Bureau of Labor Statistics in 2022. As you can see from the chart, physician has the highest average weekly average of 47.9 hours, while the rest are either at 40 hours a week or lesser. Even though the average weekly hours for nurses do not equal to 40, they do work a standard 12-hour shift, especially in hospital setting, according to the American Nursing Association. This is a good point to keep in mind as we discuss further into the topic of stress.
Due to the nature of healthcare workers, they are vulnerable to the effects of stress. And this can in turn lead to burnout, fatigue, and a decline in job satisfaction. Evidence suggests chronic stress among healthcare workers can lead to anxiety, depression, as well as cardiovascular issues and weaken immune functions. High stress can also negatively affect patient care and safety. And this is all according to the CDC.
According to Taminga and colleagues, imbalanced demands, skills, social support at work could lead to stress, psychosomatic problems, and deteriorations of service provisions. Therefore, healthcare workers are crucial to the health of the nation. Their mental health and well-being is a prerequisite for an effective, efficient, and compassionate service.
Management strategies. We will be going over 3 different strategies, and I'm going to kind of break it down in 8 different steps. So we're going to be talking about assessing needs and interest, planning, development, session details, setup, promotions, feedback and evaluation, and long-term integration. We will start with massage therapy, and we're really going to step into getting the right information we need to provide for our healthcare workers. So it's going to start with taking a survey of what needs to be, what kind of survey needs to be conducted, and making sure that we are meeting the needs of our healthcare workers. And then move on into planning. We always want to start with a budget. This is going to help us identify anything that we might need for the development part of our plan, which will let us go into the session details. This is going to be the session lengths, what areas we will be focusing on, as well as if any individuals need a specialized program to meet their needs for an extended period of time. And that will lead us into our setup. It's always a great idea to have a quiet area in the facility to make sure that not only our staff is comfortable, but also to make sure that they're able to take full advantage of the service being provided to them. One of the ways that we can promote this is to email flyers, give out promotional materials during meetings, and to make sure that the staff know how to register, how to make an appointment, and what to expect during the program. After, of course, the program is done, I will take any feedback that the participants may have to make sure that they're satisfied, and then we'll go back and evaluate on how the program affected their stress levels, either in a positive or negative way, but those will both be used in the long-term integration, which will allow us to implement this into a wellness program or into employee health centers. And this is our strategy number 2, and this will be going over physical exercise. So it'll be the same 8 steps that we did for massage therapy, but with a different key component. This is going to be very much the physical aspect. So we are introducing physical exercise, and we do want to improve cardiovascular health amongst our staff. And in order to do this, we do have to go back to that budget to make sure that we're meeting and making quality programs using the most efficient budget that we can. So reviewing cost of equipment, facility changes, instructors, whether they're either coming on as staff or as contractors, and then moving on to the development part, making sure that we are offering classes, whether it's cycling, which does go over cardiovascular, or if we're adding treadmills into our facilities, and even going as far as to offer specialized classes such as aerobic workouts, strength and conditioning, and flexibility exercises. Once those sessions are put in, we will be offering those either during our lunch breaks. We do want to make sure that these are always going to be available to our healthcare workers. So it will be before the day gets started or even after they clock out. This can mean setting up their facility with either an indoor or outdoor facility or room. And it can even go as far as being a next building over, as long as it's in an area that is accessible to that healthcare worker. Equipment is going to be that weight and cardio machines, those would be provided, and even specialized equipment after the evaluation of the feedback that we get back from the staff. The promotional materials would be the same. We would email flyers, put out flyers, and go over the different needs and expectations in staff meetings, and then really go back and help them create long-term goals and hopefully get the participation we really need and help them set and complete those long-term goals into and move them into a wellness program. So our third strategy is going to be ecotherapy. We're going to go over the 8 steps again and highlight the key features of implementing this. So we're going to assess and really conduct a survey to determine what the interest is. Ecotherapy isn't very accessible to those that are in the city, so we'll hit alternatives as well for being indoor and outdoor. We do want to establish our budget to make sure that we have the necessary costs to get facilitators and the outdoor space. And if there are none, one of the great things that we can do is create an artificial room, which will move us into the development part. So nature-based wellness experts or certified ecotherapy practitioners who have experience working with healthcare professionals will be brought in, which means we'll have adaptable activities that will be offered to the staff. And regardless of their physical ability, they should be able to participate, whether it's gardening or taking a walk or just enjoying the outdoors. And even if you're inside, you can get vitamin D or vitamin N from soaking in the sun and really just being in an opening environment. So here are our session details. We did talk about soaking in some vitamin D and some vitamin N. Another great indoor activity is going to be our Japanese flower arranging and even sitting in solitude. That just helps you not only physically, but mentally clear out your mind and your body, and also just plays into that full wellness of all of your key components. We'll move on to setup. So we did talk about indoor and outdoor spaces. We'll hit indoor first because I I live in Denton, but there's a lot of us who work out in Dallas, and sometimes that outdoor perspective and outdoor environment isn't something that's easily accessible. So one of the key features that we can do is provide a similar artificial environment. And this can be with the help of sounds such as music. You can play nature sounds in the back. You can control the temperature of the room and monitor air movements. Even going so far as creating that sunroom inside a facility, that can also be such a huge help to get some of the ecotherapy in. We'll go on to promoting, like I said, the flyers, emails, staff meetings. We really want to explain the benefits of ecotherapy and explain its effects on compassion fatigue and enhancing that spiritual health. Staff will be given information on how to register and participate, and then feedback and evaluations. Feedback will be recorded to make sure that we are getting that staff satisfaction and proving the effectiveness of the program and decreasing the compassion fatigue and increasing spiritual health. Attendance and engagement should always be monitored. That will help us go back and review the feedback and to make sure that we're doing things correctly for that long-term integration.
And now for our infographic discusses the prevalence and impact of stress among healthcare professionals. As stated in the demographic slide, healthcare employment constitutes 9.3% of total U.S. employment, with nearly 2/3 of these workers being between the ages of 25 and 54, 80% being women, and 60% being white. The report underscores the high levels of burnout affecting 35 to 54% of nurses and physicians, characterized by emotional exhaustion, reduced personal achievement, and depersonalization. Some common stress sources identified are long hours, administrative duties, and negative patient outcomes. Some symptoms of stress some symptoms of stress can manifest physically as fatigue, headaches, and muscle tension, emotionally as feelings of depression, overwhelm, and burnout, and behaviorally through changes in appetite, increased absenteeism, and changes in sleep. Both short-term and long-term stress management techniques are outlined, emphasizing the importance of mental health services, work-life balance, regular physical activity, adequate sleep, and healthy relationships. By incorporating these statistics into an infographic, the information becomes more engaging and easier to understand, aiding in the communication of the importance of tailored stress management strategies for the audience. And in conclusion, managing stress and burnout in healthcare workers is essential for their well-being and the quality of care they provide. Effective stress management strategies are crucial to support these professionals, ensuring that they have the resilience needed for their demanding roles. Prioritizing their mental health and creating supportive work environments will foster a healthier, more sustainable healthcare workplace.
And these are our key takeaways. Again, my name is Omalara. My key takeaway is healthcare workers are to prioritize self-care and seek support when needed. It's important to recognize the signs of burnout and take proactive steps to maintain mental and emotional well-being.
This is Jamie Trin, and my take key away is that the mental health and well-being of our healthcare workers should be a top priority in order for them to care for others effectively.
This is Corinne, and my key takeaway was that effective stress management strategies such as a healthy work-life balance and mindfulness are essential not only for improving the well-being of healthcare workers, but also for enhancing their ability to provide quality care to patients.
My name is Yoselin Moeller, and my key takeaway is creating a supportive environment and offering resources to manage stress. To manage stress can make a difference for healthcare workers. When staff have what they need to handle stress, they feel better and perform better, which ultimately leads to better care for patients.